Is it okay if I'm really honest with you? I recently was diagnosed, I had a CT scan because despite having done all the work in the lifestyle, getting the weight right, getting the nutrition right, my blood lipid profile was still high. And I asked my regular doctor, what else can I do? And she said, well, you should see a lipidologist. I said, what's a lipidologist? So a doctor who studies lipids. And I called Johns Hopkins. They had a lipid clinic. And I made an appointment, had a meeting with the doctor. He ordered a CT scan and some labs and an ultrasound for the carotid. I knew from the technician doing that my carotid arteries were clear. So there was no impediments or blockages for my brain and stroke and all that type of thing. But when they did the coronary scan, the CT scan, it showed a really high number for calcium. Two of my main arteries that are on the surface of the heart showed a really high number, like danger, danger, danger. Of course, it freaked me out like it would freak anybody out, but there's a thing that I have now coined called medically induced stress, medically induced fear. All right, rolling. And I was basically read the riot act that you've got to start taking statins, you've got to start doing this, you've got to start doing that. And if you feel any pain in your heart, you've got to go to the emergency room right away. So by the numbers, the assumption was if there's calcium, there must be blockages. I read the report, and the report, every second and third word was something I had to look up on the internet because you can't pronounce these words. You surely don't know what they mean. And after piecing it all together, I still had no idea what the heck it was talking about. And the first question I asked the cardiologist post that test was, how do you know if there's blockages? He said, well, we assume that there are because you have a high calcium score and your triglycerides are this and your cholesterol is that. I said, how do you really know that there's potential blockages there? And I kept digging and I kept asking and I kept digging. I finally found, it took me 3 or 4 months of nervousness and diligent study to find out that there is a medical device that can test the elasticity of your arteries. It's called a smart pulse machine. Fantastic little piece of equipment. You just stick it on your finger like a pulse oximeter. And in 3 minutes, it will tell you the state of not only your coronary arteries and your arterial system, but also the peripheral elasticity, the arteries going through your whole body. It measures the heart rate variance and several other things. I'm actually in really good health. I've been taking omega-3s for 15 years. I better be in good health. And in fact, I am. If you found the content useful, please like the video, subscribe, and click the little bell for notifications. Please use the comments section below to ask any questions or leave any comments. We're happy to help.